ದೆಹಲಿಯಲ್ಲಿ ನಡೆಯುತ್ತಿರುವ ಟಿವಿ9ನ ಜಾಗತಿಕ ಸಮ್ಮೇಳನದಲ್ಲಿ ಅಪೋಲೋ ಆಸ್ಪತ್ರೆ ಗ್ರೂಪ್ ಮೆಡಿಕಲ್ ಡೈರೆಕ್ಟರ್ ಡಾಕ್ಟರ್ ಅನುಪಮ್ ಸಿಬಲ್ ಭಾಗವಹಿಸಿದರು. ಟಿವಿ9 ಕನ್ನಡ ವಾಹಿನಿ ಮ್ಯಾನೇಜಿಂಗ್ ಎಡಿಟರ್ ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಅನುಪಮ್ ಸಿಬಲ್ ಆರೋಗ್ಯವೇ ಭಾರತದ ಭಾಗ್ಯ ಅನ್ನೋ ವಿಚಾರವಾಗಿ ಅಭಿಪ್ರಾಯ ಹಂಚಿಕೊಂಡರು. ಹೆಲ್ತ್ ಇಂಡಿಯಾಸ್ ನ್ಯೂ ವೆಲ್ತ್ ವಿಚಾರವಾಗಿ ಸುದೀರ್ಘವಾಗಿ ಮಾತನಾಡಿದರು. ಟಿವಿ9 ಜಾಗತಿಕ ಸಮ್ಮೇಳನದಲ್ಲಿ ದೇಶದ ಆರೋಗ್ಯ ಕ್ಷೇತ್ರದ ಅಭಿವೃದ್ಧಿ ಪಥ ಹಾಗೂ ಹಲವು ಆಯಾಮಗಳ ಬಗ್ಗೆ ಅಪೋಲೋ ಆಸ್ಪತ್ರೆ ಮುಖ್ಯಸ್ಥ ಡಾಕ್ಟರ್ ಅನುಪಮ್ ಸಿಬಲ್ ತಮ್ಮ ಅಭಿಪ್ರಾಯವನ್ನು ಹಂಚಿಕೊಂಡರು. ದೇಶದ ನಂಬರ್ 1 ನೆಟ್ವರ್ಕ್ ಟಿವಿ9 ಆಯೋಜಿಸಿದಂಥ ಜಾಗತಿಕ ಸಮ್ಮೇಳನದಲ್ಲಿ ಅಪೋಲೋ ಆಸ್ಪತ್ರೆ ಸಹಯೋಗ ನೀಡಿದೆ.
Good afternoon, everyone. Dr. Sibbal, a warm welcome to the TV9 Global Summit, What India Thinks Today. Before I get into a conversation with Dr. Sibbal, I'm going to request my audience to give a very warm round of applause, not just for Dr. Sibbal, but for the 1.3 million doctors and 3.3 million nurses who worked relentlessly over the last two violent, I would say, rounds of the pandemic, the waves that we saw, and worked tirelessly to save millions of lives across the country. So thank you, Dr. Sibbal, and your community for all that you've done for us.
And thank you so much for trusting us.
We had no choice. So, Dr. Sibbal, 535 million infections worldwide, 6.3 million deaths and still counting. So if there's one thing which the COVID pandemic has proved to the world, so to your mind, what have you really learned over the last 2 years of dealing with this invisible enemy? How do you look at the key learnings over the last 2 years?
Well, I think it's really been a revelation for all of us in healthcare. Nobody could imagine the scale and size of what we had to witness. But I think if you ask me, one key takeaway that we have, which really applies to us in India, is that health has become center stage. Perhaps if it wasn't for COVID, we wouldn't be talking about health. You'd have more interesting, more important topics. But now, health is part of the narrative every day, and health has become center stage. And what has happened that I think has really changed is that these silos that we had, public sector, private sector, they have broken. And when we managed COVID, the response was unified. And I'll give you a couple of data points. For example, if you look at ICU beds, there were 94,000 ICU beds for patients with COVID. Well, 68% of them were in the private sector.